In this video, we're going to talk a little bit about submitting a prescription in a couple of different ways. So here I am at my med list. I've got all my patients. I'm going to select Mr. Ford. Mr. Ford, as you can see, is 55 years old, and we have a lot of prescriptions for Mr. Ford. We can submit these. We've designed this to be very fast and easy to use for the physician, so that if this was a standard visit and I'm just doing a renewal of everything, I can actually just touch the pharmacy column saying that I want them all to go to the pharmacy. If I also want send a copy to the office, I can touch that column and I'll get a copy to the office, which I might want to add to the chart. The DC here stands for discontinue. Now I could go down here to the bottom right, press submit, and those will all be sent off. Now, I may also want to print one of these out, and so what I can do is I can preview this submission. This is called an action key, by the way, in Apple lingo, but this is a preview submission, or I could just print out the med list. And you can print to specific printers directly from your iPad. They have to be what's called AirPrint compatible. They're made by many different vendors, HP, Brothers, and many other printer vendors, and Apple has a list of them on their website if you just do a search for AirPrint. But right here I could print this out, and now I've got something that is added to the med list very easily. But one of the things we have that we don't believe anybody else does, and this is a real differentiator for us, med list for patient. What this does is try and translate what we call a SIG, which is, a signatura, an instruction from about a medication, into plain speak for a patient. Now, it's very difficult to do every one, and if we can't do it from our technology, we create a blank line and say, please ask your physician, so that they can still go home with a list of what they're supposed to do, and a staffer or nurse or the physician himself could write this one in for them. The reason this is important is this helps close the loop of what happens after that patient leaves the office. There's a significant number of prescriptions that are never fulfilled, and there's a big problem sometimes when a patient gets home. Did he say, stop taking the blue pill and start taking the red pill, or start taking both pills? And this helps gives the physician, who's not going to have time to write all this out, an easy way to help close that loop of what happened when that patient walks out of the office. If you demonstrate this to the physicians, they usually think it's very, very cool. That's a little bit about how we submit prescriptions and some of the options to RxWriter. Again, most often through fax. You can email to the office and then print it out for a standard workflow via fax machine, or print it out directly to a printer from the iPad itself. And that's a little bit about how we submit prescriptions with RxWriter. Thank you very much.